Welcome back, everybody, to the XPAND Podcast. This is your host, Zarin Beatty. I am here in beautiful Boulder, Colorado. What is this how do you pronounce this park?
This is Chautauqua Park.
Chautauqua
right
Park.
At the base of the Flatirons.
This is absolutely breathtaking. I've been here for the past couple hours just absorbing the whole environment. And I'm here with Dr. Dan Engle. It is a pleasure to spend some time with you right now. Thank you for being here.
Yeah, likewise, Zarin. Thanks for making this happen.
Yeah, of course. We're smoking mapachos in the beginning and through the duration of this episode. Something that means a whole lot to me would be the mapacho. And I know you've spent a lot of time down in Peru with the plant medicine. And now I've heard you've done over 400 ayahuasca ceremonies. Is that accurate?
Yeah, it's about right.
So I've been down to Peru twice, and both times with Don Howard. So I've partaken in 9 ayahuasca ceremonies. And it's become such a beautiful part of my whole being, and continually integrating these lessons and messages that are shown internally and externally in your environment. And Wachuma is beautiful at showing you messages hidden in the forest.
Mm-hmm.
And did you notice any kind of wave of lessons that kind of cycled through that many ceremonies? And about how long of a duration have you been working with Mother Ayahuasca?
I was introduced to ayahuasca about 12 years ago. Is that right? 12, 13 years ago. And was just hooked straight away. It was like, oh my gosh, I have found my teacher. And I had just finished all my medical training and was running a clinic and in psychiatry, integrative psychiatry. And then I was introduced to ayahuasca and it made all my training look like kindergarten. It was amazing. And I didn't start working with her really deeply and regularly for about a year or so after that. And then it was pretty full on. Yeah. And then about 3 years after my initial sit is when I moved down to the jungle and really just dedicated my full time, full attention, full life.
What kind of decision was that at the time? Because I'm coming to kind of a point in my life right now where it's like I've been following a feeling of alignment for so long, and now it's come to a position where it's like I may have the choice in which direction I go in. So what kind of feeling or what brought you to make that like actual decision?
Yeah. Well, Joseph Campbell's fond of saying life is one hero's journey after another.
I like that.
So that was definitely one level of initiation, and hearing the call and the soul's calling. Because the hero's journey starts with the soul's calling, and that calling for alignment. And it's not usually driven from the ego. And if it is, then we're going to really get our asses kicked. Because we can romanticize what the hero's journey looks like. But that walk is one of the unknown. And it's coming up deep and intimate with all of our shadow, our fears, our insecurities, our longings, our attachments, as well as the potential for liberation. And that's why we get called on the path in the first place. And for me, it was a relatively easy choice because I've always had an adventure spirit. I wasn't really attached to practicing Western medicine. And I had this sense that there was something else. And I didn't realize my soul was longing for a depth of connection that I hadn't experienced yet. And when I was turned on, it was a fairly easy choice. Again, I didn't know what was going to come, and it was preceded by a deep prayer to open up my heart. Because I had just come out of a marriage and a relationship, and I couldn't feel it. Couldn't feel the grief, although I knew it was buried deep. And I wanted to access it because I didn't want to spend the rest of my life walled off from my true feelings. And about 3 months later is when I was introduced to that first sit. And so there was just this alignment, like the cosmic Tetris game just fell into place for me to have the opportunity to go down and to fully surrender, and then to get completely deconstructed and slowly put back together again. And it's been a path that I can't really conceive of what my life would be like now had I not found the medicine path.
I can relate there for sure. It seems to be that the medicine, it works in a way where, for me, everything boils down to perception. So like meditation and plant medicine and martial arts and discussion and relationships and communication, they all boil down to like one component, and it's how we perceive the information that we receive and how we integrate and respond to kind of what's happening unconsciously or consciously. So yeah, just 400, that's something that I can only begin to fathom as you go deeper and deeper, as you open up more and more.
Yeah.
And where do you feel like your mindfulness has gone since the beginning of that journey? Because even for me, through a decade of meditation and some other types of experiences, my mindfulness has skyrocketed in both directions, internally and externally.
Mm-hmm.
And I don't even know how to articulate this question just from your background of experience.
Yeah.
Have you really felt that like upgrade?
For sure.
Like what are some things that you have become aware of?
And meditation is a really phenomenal foundation for this kind of work, because it is a consistent dedication to sit and listen to the chatter of our mind, work with different practices to help quiet the mind, and slowly evolve this ability to see that from a observation platform, get a different perspective, a different perception. And the more we can generate compassion for the nature of the mind, because this ego is really phenomenally brilliant and crafty bugger that is our navigation system for interacting with the world. And for a while I tried to make my ego wrong or bad and transcend it or conquer it or kill it or deny it and overcome it. And now we're more like friends, and I'm desiring to develop more and more of that intimate, compassionate space for the silly, crazy things that my human mind consistently does on a regular basis. And the medicines have certainly helped me with that. My lead in to the medicine work was with Native American shamanism, Lakota medicine, and Tibetan Buddhism. And so I had practiced meditation and sweat lodge and spirit dance for 8 to 10 years or so prior to my first sit with ayahuasca.
What a foundation.
Mm-hmm. It was a really good foundation, and it took it to another level.
Mm-hmm.
Because we don't know what we don't know. And when we're in meditation, it's a concerted effort to generate the discipline to become still, and the curiosity to see what arises, and the non-attachment to be able to let it go. And yet we're still running subconscious programming around early experiences that we don't fully understand until we've gone through a transcendent process of uncovering those formative first 5 years. That's largely responsible for what we believe about ourselves and about life.
I know you're huge on integration and floating, and I've caught up on pretty much all of your episodes up until right now. And you mentioned somehow like 60% of the formula boils down to integration and how we kind of process the experiences. And where do you feel like meditation and floating kind of help with that process? Now right.
So good.
So good.
So good.
I'm really excited to hear your perspective on this, because I mentioned this to you last time, between 200 and 300 times. And it's taken my just experience as a person to a whole different level. And I'm not a drug addict. I'm more of a normal human being in that aspect. So, but you have such an array of examples to kind of pull from, and how you've watched people improve through these modalities. So where do you feel like floating and meditation really come into play with just this concept of integration or internal work?
Yeah, it's a good question. I recognize I'm distracted by a conversation that you and I had earlier about this client that I had a phone call with right before you and I met. And this woman was in just a deep degree of suffering, had exhausted most of her resources, is standing on the ledge, and she's essentially like, I don't know what to do. And there's still a part of me that really desires to do everything I can to help others out of a sense of compassion and service. And it was a helpless feeling. This was a virtual call. She's calling from halfway around the world, and I don't know her local resources, and there's a lot of physical challenges that she's going through. So it's not an easy call like, oh yeah, just do ayahuasca and you'll be fine. And still, I want to say that. Just do ayahuasca and you'll be fine. It's not totally true, because not everybody's ready for a medicine experience. And if we have done the work, as much as we can tell what that work is, to become ready, we've developed a degree of understanding of our triggers and our ability to self-regulate in the midst of the ego getting really crushed, and now I'm suffering, and I don't even know why. Can we look at it? Can we become intimate? Can we get close with it? Can we want to get to know it? Like Joseph Campbell says, in that cave you fear lies the treasure you seek. Can I get curious about that cave? Meditation and flotation are phenomenal preparation and integration tools, because flotation is essentially meditation on steroids. It's the first time without environmental stimuli, so we're really just drawn deep into a closer contact with the subconscious and what's lurking behind the curtain. And I love floating because anybody can float, just like anybody can meditate. Although meditation is not good for everybody. There's some really good data to show that mindfulness meditation is really lousy for PTSD, post-traumatic stress disorder, because mindfulness is essentially the invitation to be present with what is. And if you have somebody that's running a trauma experience and you're asking them to be present with what is, then they're just going to loop in trauma. And we can't save ourselves. It's really freaking hard. It takes a lot of skill to be the person on the couch and the person behind the couch, so to speak. The client and the therapist, or the person receiving the healing and the observing witness knowing how to orchestrate that healing. So to ask somebody to just be mindful of their trauma can actually continue to create the experience where they get stuck in that trauma loop and feel it or re-experience it or get to that degree of desperation. And this one woman was essentially in that space. And it reminded me of my sister and her committing suicide, and my experiences with depression, particularly coming back from the jungle and not knowing how to reintegrate into society. And so this is where hopefully we don't do it alone. No one's going to be able to walk in our shoes, but we're not meant to do it alone. We're born to bond, and it's super important to have these levels of connection with like-minded, like-hearted spiritual warriors along the path, and how we lift each other up and support each other and recognize our own process in one another. And I do believe the medicines carry an enormous potential for benefit. Absolutely. I do believe there's a level of sophistication in order to work with them well. We were just talking about Don Howard and smoking a mapacho, which is tobacco, by the way, if you don't know what mapacho is. It's Peruvian tobacco. And we were speaking about Don Howard, one of our shared teachers, and his level of what our perception is of his consciousness, because we're not going to know exactly,
For sure.
because I'm not in his head. But I get the sense that dude's been around the block a time or two, and he's certainly been in the medicine path for a long time, and he certainly facilitates some extraordinary ceremonies. And ultimately, at the end of the day, I love Don Howard's comment too, that the warrior's heart beats as one heart.
I was thinking that as you were saying that.
Yeah, right. And so what does that mean? And how do we see each other from a shared perspective?
And support each other along the way.
Mm.
I mean, that aspect, I really experienced that during the Fit for Service weekend. So there was like a group workout where we had to work as a team, and there was a point where I was pushing my hardest and I couldn't go anymore. So I pulled back and rested. And the other people came in and stepped up when I was able to rest and recover. And then when they were tired, I was able to come back in and kind of fill their spot and keep the machine rolling forward.
Mm-hmm.
So I felt that in a very visceral and different context of experience. So it's amazing how relatable that concept is in many different aspects of life.
Yeah, there's a Maori saying along that same vein: we're stronger together. When we rode together, we're stronger together. And watching these birds fly around the park, and how birds, particularly geese, when they migrate, they have a lead goose, and the lead goose is breaking the wind for the others to draft behind. And when that lead goose gets tired, it drops off to the tail, and somebody else assumes that lead position. And so we're essentially living in alignment with nature and what we know to be the best opportunity for us to collectively succeed and go through this crazy, beautiful, precious human life in a good way.
What do you feel like collectively succeeding would be?
Well, when we get through the ego's attachments, we recognize that a lot of things that our mother culture, which is a term from Ishmael, speaking about the mother culture and how we've been programmed to believe that success is going to look a particular way. And yet, when we check off all those boxes, many of us don't experience that degree of promised fulfillment. I've got the things. I've got the car, the cash, the partner, the house on the hill, the whatever it is. And when that doesn't fill me up from the inside, there can usually be a big vacuum, a big hole. So I work with I have friends and clients and very successful people, and find the medicine path because they've checked off all the boxes and they're like, yeah, that didn't do it. So now what? And ultimately, I believe the path of success is fulfillment, and the fulfillment is that transition from external goals to internal goals, external validation to internal validation. And we slowly start to fill up this experience of sufficiency, like I am enough, my life is enough, I'm contributing, I'm a part of the beautiful tapestry of this entire life. Everybody else is too. Everybody else is a spark of the divine, no better, no worse than me. And we are connected in this one rock that we call home. And my success and fulfillment and joy is related to everybody else's. So ultimately, at the end of the day, if I choose for everybody else to experience the same things that I'm choosing and desiring for myself, then I see we're all in Ubuntu, which is a Swahili term for I am because we are. When we all carry our basket of fruit across the line together. There's this great story of an anthropologist that goes down to Africa, and he's trying to teach kids, among other things, English, but puts all these kids into a race and says, okay, here's the starting line, here's the finish line. First one across the finish line gets this basket of fruit. It's very American. And so race goes off, kids start running, and then the one in the lead looks, halfway down the track, he's obviously gonna win if he's continuing that pace and that trajectory. But he turns around and sees a couple of kids in the very back, either like picking grass or struggling, or I don't remember the exact story, but they were way behind. So he stops, goes back, and joins the kids in the very back, and they all cross the line together. And then the guy who's trying to teach them how to run the race, he's like, what are you doing? You're going to ruin the race. And the little kid's response was, yeah, but why would I want to have all the fruit when other people don't? It was completely out of the world view, like that I would have something that others could benefit from, and yet I would keep it all to myself.
That's too real. That's too real.
100%.
There's something that cultures can show you that nobody else can. To be able to like have children teach a person that in a different culture, that's an embodied wisdom, an experience that transcends. Now it's being relayed into this discussion, and now I'm learning from it. It's something that holds so much value. Something that I would really love to kind of hear from you would be that's awesome.
Just a little crowd humor to sprinkle in
That's so funny.
the importance of laughter and not taking it all so seriously.
So you embody your teachings and lessons very well. Like you hold a presence that really does show or resemble a path that you've been able to walk. And a lot of people noticed this when you spoke at the Fit for Service group, and how like your words came from a different place. And whether or not people have experienced the medicine, it's something that our nervous system can see and understand, like that's genuine and that holds value. And he's speaking from a place of truth, and that sings inside of other people. And so you having such an incredible background with Eastern and Western medicine, how did you kind of find the thread to weave these through each other? Was there a common like theme that you noticed, or a puzzle that one part could fill which the other part couldn't, but this part could fill something that this part couldn't? How did you kind of put together this formula?
Yeah, that's a great question. I like the nature of that question because it highlights for me what's part of the drive for that has always been inclination and orientation. I tend to orient towards inclusion and seeing how systems can work together in cooperation versus in competition. And Western allopathic medicine it's been a very competitive field. 100 years ago, Western medicine, allopathic medicine, was equally appreciated as homeopathic medicine and herbal medicine. No one at that point really in the West knew about Chinese medicine, and Eastern philosophy. That didn't happen till later. But slowly over time, the allopathic community really actively ridiculed and pushed out the other disciplines: chiropractic medicine, naturopathic medicine, osteopathic, herbal medicine, and made them wrong, and established the lead goose position for 100 years. And then eventually that started to shift about 20 years ago. We got more into integrative medicine and functional medicine, still using a fairly reductionistic and Western view. But it was better because we were saying, oh, like maybe there is something to these Eastern practices. And now acupuncture is in hospital systems and Reiki's in hospital systems. And that wasn't the case 15 years ago. And it's slowly catching on. And most of it's a consumer-driven movement because people are appreciating the fact that allopathic medicine has its place, for sure. When I broke my neck, I didn't go to my herbalist first. Thankfully, I was staying with people that had more sense than I, and they told me to sit still and we're going to call 911. I'm like, I think it's actually okay. And they're like, yeah, we don't. So I went to the hospital and they were like, yeah, you broke your neck. And so a neurosurgeon was involved in the assessment and screwed a halo into my skull, and I wore that for 3 months. And I'm super glad that we had that medical technology and that we still do. And allopathic medicine's amazing on the battlefield and in the emergency department and in the operating room. And yet it's only one chair at the sacred table of the integrated services. Every part of medicine has its place, particularly systems that have been proven over time. And this field that we're moving into now is transformational medicine, which is so dope. because that's the inclusion of the right practices as best as we can weave together with our current understanding and the ability to provide different traditions in their service orientation through a codified and artful protocol. Because just because you have a whole bunch of ingredients, if you throw everything into the pot, doesn't mean you're going to create a good recipe. So we have to know how each of those ingredients works. So I've studied a lot of different medicines. My first true mentor was a chiropractor. And I went deep into chiropractic medicine, and then I started studying with naturopaths and osteopaths. And my first clinic was in an Eastern medicine office. So I started studying acupuncture and Eastern herbal medicine. And then I eventually, as mentioned, moved down to the jungle and studied Peruvian shamanism and ayahuasca. And now I have and I'm still learning and growing for sure. I still think I'm a rookie in so many regards, and I hope I keep a beginner's mind, because I'm curious to see how we can continue to refine our practices over time. And this field of transformational medicine is much of a remembering of many traditional medicine values around looking at a multi-tiered system and a multi-layered system of humanity, body, mind, heart, and soul. And when we understand how to assess each of those systems, and then how to address the imbalances in each of those layers, then we get more effective in our protocols and steward people through a process of transformation. And these medicines have a huge portion of opportunity to help many of the epidemics that are alive and well in our society right now: depression, anxiety, PTSD, addiction. And to offer a menu of services where people can come into a clinic with trained providers who have an understanding of different fields of medicine and different ways to intervene, and then offer a menu of services to be able to walk people through a steady progression of getting more and more in touch with the fullness of who they are, including their trauma. And that's not always easy or fun, but in my experience, it's absolutely 100% necessary to understand the fullness of life, and then to come out the other side with more reverence and gratitude. The hero's journey involves the dark night of the soul every time, if we follow it through to its completion, or at least follow it through to its next octave of evolution, because we're continuously spiraling up. And that dark night is a massive teacher.
What kind of perspective do you feel like the medicine can provide in those kinds of circumstances? Because you kind of mentioned back earlier how it's hard to be, the person in the chair and the person behind the chair, but it's almost as if the medicine's able to show you that scenario.
Bingo.
So
Bingo. It's amazing. For example, if we take one of the big medicines that's on the horizon for legalization right now, Mdma psychotherapy. Mdma-supported psychotherapy is the best treatment that we know of in today's day and age for chronic severe PTSD, post-traumatic stress disorder. Its success rate is orders of magnitude better than anything in the standard of care right now. The standard of care is mostly around managing the symptoms, psychopharmacology, prescription medications, and psychotherapy, usually cognitive behavioral. And they're maybe 30% successful for improving symptoms. But something like MDMA-supported psychotherapy is like 60 to 70% successful for curing symptoms. And that's only in 2 to 3 sessions. And the way it works is phenomenal, because it does just what you said. It allows us to be both in the chair and behind the chair, neurochemically, neuroanatomically, because it does 3 things. And many of the medicines work similarly, but we'll just speak about MDMA for now. It, in the midst of the experience, it softens and helps to quiet the fear center in this place called the amygdala and the limbic system. So there's not as much fear as the trauma's coming back online. It improves the blood flow in this front part of the brain, right behind the forehead, called the prefrontal cortex, which allows more of a witness observation perspective, and it improves the connection between this observation perspective and the memory center, the hippocampus. So if you put all three of those things together, it softens the fear response, it gives us better witness perspective, and it gives us better memory of the entirety of the traumatic experience in the first place. So we tend to have a better understanding of all of the influences and the causative factors that led up to the trauma in the first place. And because now the fear centers are a little quieter, oftentimes very quiet, we can get into the trauma and re-experience it in order to have a healing, even a corrective experience, to come out the other side and feel liberated from it. And not that we're liberated from it and we leave that trauma or that traumatic part of ourself behind. It's actually being liberated from the experience of disconnection and being cut off from the trauma, so that the trauma gets integrated into a greater sense of who we are and a sense of wholeness as a human. Because whether we know it or not, that traumatized part of ourself that's defended by these ego defense patterns stuck away in the subconscious netherworld and closets of our subconscious now starts to come up to the surface. And we can get to know it, understand it, learn from it, grow from it, heal it, integrate it, and then become more whole on the other side.
What a powerful formula.
It's phenomenal how it works. I mean, it's hard. It would be hard to literally script a better pharmacologic process for healing trauma than what MDMA
That's incredible
therapy provides. Yeah.
And for it to be chemically that way and also experientially that way, that's unbelievable.
Yeah.
It's incredible when you think about when we push away traumas or things inside of us that we don't want to look at, when in reality, that is a part of us that if we love, then we are loving more of our being. So the more of our being that we can love and send love to, the more healing that happens, the more you're able to see of yourself, and the better you're able to integrate those parts and segments into a whole being. Mm-hmm. I felt this on many different occasions. Mm-hmm. But with something that's super traumatic, to have that ally come in, man, and like break down the walls and help absorb all of the information, that's true medicine.
That's true medicine.
That's healing.
Right. At this point, we're not just trying to manage symptoms. We're actually trying to get to the core and liberate the core into a more full, whole experience of self. And this is the difference between recreational MDMA experience and therapeutic MDMA experience. Because a lot of people will say that they've worked with MDMA and they've done it at a rave or a concert or a party, and they're like, oh yeah, I've been there and done that. It's apples and airplanes different than doing that kind of medicine work in the context of a trauma-trained provider.
Would you mind going deeper into that? Because I feel like that's such a vital discussion or information for people to hear, whether it's psilocybin or MDMA, but that set and setting or that respect for the process.
Yeah, 100%. It's vital that we have the intention for healing and the willingness to surrender into that cave. That's the mindset going in. And it's vital that we have the right setting, calm environment, controlled environment, a safe environment, with somebody who knows how to support this kind of work and facilitate that kind of healing. So somebody who has done some degree of counseling and therapeutic training, they understand the depth of their own insecurities and attachments, and more of an ability to check themselves if they're projecting their own stuff into the therapeutic container, and also knowing when not to intervene. There's a lot of early therapists, myself included, when I was early in my psychiatry training, I wanted to do more than I needed to just to feel useful, that I was actually involved in the process, or I wanted to try out these different psychological theories and practices that I was learning in the classroom. And we typically do that, one of my teachers, who's also a chiropractor, he's fond of saying the early stage herbalist will work with the primary 12 plants. The intermediate herbalist will get excited about using the 200 to 300 plants that are available. And the master level herbalist will come back to the original 12 and actually know how to use them. So
That's amazing.
Sometimes it's just about getting simple and also knowing how to use them well, but getting out of the way and not trying to do too much.
It's funny how it comes full circle that way.
Yeah.
Well, it's the fundamentals to anything really seem to hold the most value, but it feels like we have to understand that, expand past it, and see what isn't useful to come back to what really is useful.
100%.
And I feel like that's with meditation or martial arts. It's like, it's almost, or becoming more mindful. It's almost like finding all of the ways that don't work for you to understand what does work.
Mm-hmm. Yeah. It's understandable that would be in our inclination to do, especially if we're desiring to be masterful at whatever practice we're engaging. You have to get it wrong before you can get it right. And so I'm going to go down a lot of rabbit holes and mess up and crash and burn. And I've been completely dismantled in ceremonies before. Funny enough, just to look back in like Iboga, the first time I did Iboga was after my sister committed suicide and I had studied with only ayahuasca up to 8 years, for 8 years up to that point. And then when she passed, it was super unexpected. She'd been sober for 14 months, and then we don't really know what happened, but there was alcohol involved and a gun involved, and she was dead. And then that was my calling. That was me getting called out onto the stage, so to speak, or above the radar, to actually start doing education advocacy work for the medicines to the collective. And so I also wanted to learn more about the medicines that are really good for addiction, because that's what she had been just suffering from her whole life and had done all the right things in the standard of care. She'd gone to counseling for years and years, been on a slew of different pharmaceuticals for years and years, been in AA for years and years, and the list goes on, and yet it still wasn't helpful at the end. And so I wanted to understand these medicines are really good for addiction, so I started studying Iboga and Ibogaine, and worked with Iboga for a fair bit, and then started medically directing a Ibogaine center in Mexico because it was legal there. And my first time with Ibogaine was right after a 2-month dieta. And it was only a few weeks after, and it was probably not long enough, but my teacher had said it was probably going to be okay. But I was so wide open, and Ibogaine just came in and just completely manhandled me. So there have been, and it was really humbling and really awesome because I got to see how our clinical team deals with people who are just way out of their mind and don't know how to pull themselves back together. But I probably got triple the dose of what would be therapeutic. And what that ended up just teaching me was a lot about humility and a lot about the fact that, yes, I'm willing to put myself in the laboratory because I want to know these different experiences and how these medicines work. And what's different between Iboga and Ibogaine? How are they different? And how is working with the whole plant of Iboga different from working with the primary alkaloid in Ibogaine? And they're very different. Ibogaine is actually safer to work with in the clinical setting because it's more specific dosing. It also doesn't last as long. But Iboga has all of the plants, so you get more of the psychospiritual process and practice. And there's a constant evolution of what we're learning about ourselves, particularly when we're willing to get back in the laboratory and see what wants to happen next. So the best opportunity to, in the mindset, coming to a medicine experience is as long as the setting is safe and you can trust the facilitator, and that's a whole nother conversation. Like, how do you trust a facilitator and who's ready to actually, because there are a lot of people going out of the jungle and coming back and saying that, they're a shaman now and putting on a poncho and offering yogawaska. And maybe they're doing it out of a place of altruism, but it might not be from a place of really deep wisdom or even excellence. So things can get really sideways.
I think there's a Carl Jung quote that's, "Be aware of unearned wisdom." And I always find that interesting.
Yeah.
Because wisdom, I feel like, can be felt in people. Like Don Howard holds wisdom, right? You hold wisdom through your experiences. And I feel like that's when we know ourselves deeper, then we can feel that in other people a little bit better. That's kind of, the full circle of everything, really.
Yeah, it's true. The medicines can show us a lot. You can show us a lot about ourselves, about life. That's a peak experience, but we're not designed to live on the peak. Otherwise, we wouldn't be in a body in the first place. It's like, how do we bring that peak and we make it boots on the ground, workable for life? And to actually integrate that degree of teaching consistently over time, because slow change is actually lasting change. That's why fad diets don't work, and these really big things that we try and shortcut. You can't force that flower to open. You force a flower to open, and you've just fucked it up. And then there are a lot of people, myself included, can get seduced by the medicine experience. I wasn't so much seduced by the experience of being in the medicine space, like when I was living down in the jungle, and we were drinking 6 days a week. It wasn't. I know, it was pretty intense. That was the apprenticeship path. So, and I was fully in that apprenticeship mode. And it wasn't so much I was getting seduced by the experience, although I had some phenomenal experiences. It was for the first time for me, I felt like I could trust a process. I didn't realize up until that point that I didn't really trust people. And that was from a whole slew of early childhood experiences. And when I found the plants and the plant medicines, I realized, oh, wow, I can really trust you. I can trust this process. I can trust my connection with nature. And I don't have to go through the priest to get to God. Or I don't have to go through the doctor to get to healing. I can create a relationship. We can co-create this relationship, nature and I, and the plants and myself, with a lot of support for sure. Had a lot of great teachers along the path, helping to steward and help me navigate. But it was that trust. It was the first time I felt fully open into a process that was teaching me about life and myself in ways that I'd never experienced.
Well, when you can feel those lessons to that degree, you understand the importance of them. And when we understand the importance of that, it's much easier to have faith or to follow the path. I resonate so deeply with what you just said. Mother Ayahuasca specifically felt like building like a pure and beautiful relationship with this medicine. And the better I prepare and the preparation beforehand, the better that relationship gets. And the more I follow my intuition, the better that relationship gets. It's so fascinating how, whether it's in Eastern philosophy, but how you have a relationship with every single thing around you, people, yourself, nature, this water bottle, anything, and how we manage our relationships determines like pretty much who we are and what we do and what we are essentially.
Yeah. Yeah, and these experiences teach us that in a way that it's really hard for us, particularly in our busy Western culture and minds that are fairly disconnected from nature. These are practices that help us reconnect to that pretty quickly, to see how we've been living out of alignment. Like, we've been talking for 30 minutes. I don't even have my bare feet on the ground.
Yeah, no joke.
I mean, that's like another perfect example.
Yeah.
And one of the things I loved so much about living down south in the Amazon River Basin was I didn't wear shoes for a year.
That's amazing.
Dude, where I was staying, there was no running water, no electricity, no other gringos. It was just the pace of nature, and it was super healing.
The pace of nature, man. It has its own time frame. Dr. Dan, I could talk with you for literally hours. I know our time's kind of been cut short today. That's completely necessary and completely okay. Thank you so much for your time. I hope this suits people in a jumping off point to look more into you and kind of cover a foundation kind of your experience and your platform as a person. Do you have any kind of remaining words to share? Anything that you feel like should be expressed?
Yeah, we've been talking a lot today about medicine work, and I imagine there's going to be quite a few people who are exploring the medicine path, whether it's through listening to your podcast or many other podcasts and books and movies, and there's more and more, it's catching on, right? Like people are hearing about it. And it's up to all of us to use them responsibly, because we don't need to recapitulate some of the mistakes that we made in the 60s and 70s, because we don't want to give the doubtful powers that be or the administration, or even for me, the medical board, reasons to say that this is dangerous work. So it's up to us to use them responsibly and to share the data. Be the change that we want to be in the world without evangelizing first. And when people are curious and when they are more aligned to ask, like, what are you up to? What's your gig? And how'd you get to where you're at? Then that's when I typically share data. And if they're curious about my story, then I'll share my story. But first and foremost, I just try and share data, because the data is amazing. And so it's up to us to be educated consumers and responsible consumers. And from that place, I think then we're all ambassadors. We're all advocates.
To embody the wisdom, to embody the lessons, and allow our behavior to show the work for us. So I feel like you do that exquisitely well, and Don Howard has done that on a completely different level. And he's showed me what embodied wisdom feels like in another person to help me kind of perhaps put that on the radar of my compass to move towards or work with or integrate into my own behavior, and try and feel his presence with what I do and just become the person that we should be. Dr. Dan, thank you so much.
Yeah, likewise, Aaron.
Appreciate it.
Look forward to the next conversation.
For sure.
Cool.